Confusing symptoms with diseases is one of the biggest errors in modern healthcare thinking. A symptom is a manifestation. Disease is a process. If we treat manifestations as if they were the cause, we intervene only on the surface and leave the underlying dynamics untouched. This topic isn't just for patients. It's especially relevant for professionals. Biomedic model, BOM. In the classic biomedical model, the symptom is an indicator of disease. Disease is an anatomical or physiological alteration. Treatment aims to eliminate the symptom. This approach has been fundamental in emergency medicine, acute infections, and surgery. But when it is taken to extremes, risks arise: suppression without understanding, medicalization of adaptive processes, and increased iatrogenesis. The symptom becomes the enemy. Biology of meaning, BEMIS. From the perspective developed by Gerd-Hamer, the symptom is not an error, it is a phase of a biological program with adaptive meaning. Here the difference is clear. The symptom is equivalent to a visible expression of a program. Disease is equivalent to the set of phases in a biological process. A symptom can be part of the solution, not the problem. Inflammation, for example, is not always pathology. It can be repaired. Pharaoh model. Integration of body, mind, and soul. The Pharaoh model expands this understanding by integrating profound dimensions. Jung, symbolic dimension. Since Carl Jung, the symptom can have archetypal meaning. It is not only the tissue that reacts, the psyche reacts. The symptom is an embodied symbol. Wilbur with his AQEL model. Since Ken Wilber, we must differentiate biological manifestation, individual external quadrant. Subjective experience, individual internal quadrant. Cultural beliefs about illness, collective internal quadrant. The intervening healthcare system, collective external quadrant. If we reduce the analysis to one quadrant, we confuse symptom with structural illness. Traditional Chinese medicine. In TCM, the symptom is a visible qi imbalance. Illness is a sustained disharmony of the system. A cough is not an illness. It is a sign of a disturbance in the lungs or in the energetic dynamics. Medical and philosophical Taoism. The Tao teaches that illness appears when prolonged harmony is lost. The symptom is a warning. Disease is a persistent deviation from the natural flow. The wise person does not fight the warning. They correct the course. Key distinction. A symptom can be an adaptation, repair, discharge, or protection mechanism. Disease implies loss of regulation, chronicity, and sustained structural damage. Pharaoh therapy. Its objective is not to eliminate the symptom at all costs, but to understand its function at different levels. Body level, rigorous clinical evaluation, intervention if there is a real risk, and avoidance of unnecessary overtreatment. Energy level, regulation of the biological terrain. Acupuncture or herbal medicine when appropriate. Conscious Qigong movement. Emotional level. Identify the active conflict, release the associated narrative, and restore a sense of security. Consciousness level. Reframe the symptom as a message, avoid exaggerated fear, and regain cooperation with the body. In the Pharaoh model, understanding the symptom is not about interpreting it quickly. It is about discerning its multiple layers. Discernment involves differentiating without fragmenting. Organic dimension. Is there real structural damage? Is it an inflammatory, degenerative, or functional process? Is it an adaptive phase or a loss of regulation? Biology is not denied here. It is studied rigorously. Conscious psychic dimension. What emotions are active? What thoughts sustain the process? What narrative maintains the distress? The symptom is often sustained by interpretation. Unconscious dimension. Since Carl Jung, the symptom can express unintegrated shadow, archetypal conflict, and unreconciled internal polarities. The body symbolizes what consciousness avoids: language and narrative. The way the patient tells their story reveals identity associated with the symptom, secondary gain, and biographical meaning. Changing the narrative changes the biological experience. History and trauma. Early experiences, highly emotional events and losses, humiliations, rejections. The symptom can be an echo of an unmetabolized memory. Here, the biological understanding proposed by Reich-Geerd-Hamer comes into play, without reducing human complexity to a single conflict. Disharmonious social context. From Ken Wilber's comprehensive perspective, we see a toxic work environment, economic pressure, violent relationships, and a suffocating performance culture. Not every symptom originates within the individual. Many are adaptive responses to dysfunctional systems. Clinical principle: a symptom is multidimensional. Reducing it to a single cause is clinically impoverished. Discernment is not complication. It is avoiding errors. Message for professionals. When professionals confuse symptom with disease, they accelerate intervention, increase medicalization, and reduce clinical listening. Distinguishing between them improves discernment, reduces iatrogenic effects, and increases therapeutic precision. Mature clinical practice distinguishes levels, final learning. The symptom is language. The disease is a process. Listening before suppressing is the most ethical act of conscious medicine. Lighthouse phrase. Not everything that bothers you should be eliminated. Sometimes it should be understood. When the symptom is understood in all its layers, it ceases to be an enemy and becomes a guide. Join the channel, love the video. Share this channel to create collective awareness. Join the Lighthouse movement.